Hello, everybody. Good morning, good afternoon, good evening, wherever you are. My name is Milen Jacob from IRS Group, one of the All Stars premium preparation providers for OET, and welcome to this session. So, if you're able to watch me, listen to me, let me know in the chat box. I would also like to know where you're joining from and if you're preparing for OET. If you've got a test upcoming, let me know that as well. Great. So I'll wait for your chat for a second and so that I can keep track of what you're telling me. Excellent. So today we are going to look at OET writing, and we'll be focusing on an aspect of writing which a lot of candidates have a lot of questions on and confusions on. It's on how to write with the reader in mind. So I'll wait for everyone to join and then we'll get started with this exciting session. Hello, Brahmaji, Manju, Wasim from Bangladesh. Right. All right. Yeah. Susma, Lima, Homa, Nuri, Raj, Nijian from Colombia, Bunmi from Nigeria. Hello, everyone. Naeem from Singapore. Hello, Dr. Devan. Hello. Quinita from Manila. Hello, Shamahat from Nepal. Hello, everybody. Nice to see all of you. Raj from Mangalore, lovely coastal city. Hello, everybody. Isaac. Hello, Isaac. Thank you. Great. Good to see all of you joining. And let's get started. So, hello, everyone. I am sorry I can't read all your names, but I will be following your comments and questions as we go. Good to see all of you from all over the world, from the Middle East, from Africa, all over Asia. Hello, Arya. Hello, Huma. Coronary. Hello, Susu from Myanmar. Hello, Soumya from the Kingdom of Saudi Arabia. Someone from Romania. Hello, everyone. Everyone. Maggie from Lesotho. Good. Hello, Jismol. Hello, Rashmi. Nice to see every one of you. And I'm glad that you're all preparing for OET. And I want to help you in your writing today. So I've got a question for you. Hello, Deepa from Delhi. Marita. Hello, Marita. Hey. So, my question is, did you know that the reader determines your success in OET writing? Now, a lot of candidates I teach and I meet every day ask this question: how do you write to this particular person? If I'm writing to a nurse, a GP, a dietitian, how do I write appropriately? And this is really important. And if you look at the OET's writing assessment criteria, the reader is one of the most repeated words. So it's really, really important that you focus on the reader. And are you aware of what reader awareness is? This is something which is very crucial for writing precisely and getting a great score in OET. So this is something which we will cover today. So what do you mean by reader awareness? In the chat box, can you tell me what you mean, what you understand by reader awareness? What is reader awareness for you? So it says a listener is a good reader. Yeah, absolutely. You need to listen. Yeah, but in the context of writing, what is reader awareness? How much thought do you give about reader awareness? Sorry, when you are planning your writing and indeed writing. the letter. Hello, Bibin. Great to see you. Maria says you write what you think the reader wants to know. Absolutely. Very good. So, while your answers keep coming, I have a few questions which you should ponder over. Manju says the writer should think I am the reader. Absolutely. You should step into the shoes of the reader. Queenie says knowing the profession of your reader. Absolutely. So, who are you writing to? First stage of that planning, and then you move on to why are you writing to them. There is a reason. Now we'll discuss purpose in detail in another session. So the purpose, the reason why you are writing. Hello, Chinnu. You're a great teacher, and good to see that you are here in this live session. So the knowledge of the reader, absolutely. And Roby says it's about what the reader needs to know, what you're writing to him, her, a letter. Usha says what they actually need to know. Yes. Writer's knowledge of the person he's writing. Absolutely. I totally agree. And now I've got the third question for you. What do you want them to do? When you write an OET letter, you want the reader, the receiver to do something for your patient. What is that? You want to, take care of them, the particular condition, further management of, let's say, their wounds or pain or whatever, or do you want them to run investigations? Maybe it's a query and you want a definitive diagnosis. So what exactly do you want them to do for your patient? That is, again, one of the most important questions that you should answer while you plan the letter and when you write as well. And in order to do that, what information do they need? So the third question is, what do you want them to do? And finally, what information do they need to do what you want them to do? So this is like a cycle. Hello, Dr. Violet. Good to see that you are joining from the UK. Reader awareness is being concise with the message we are giving to reader and making it clear to him. Excellent. Manju says patient care. Yes. Saeed says help me writing. Right. You need help in writing. Absolutely. You can indeed, get help, which I'll talk to you in a moment. Keep tuned inside. So a few more questions which will help you to plan, prepare, and get set for the rest of the day's session. What I've got in store for you. Deepa says the purpose of the writer has to be done by the reader. Yeah. Now, is the content relevant to the reader? So we're going to look at a few aspects across criteria, which keeps the reader in mind. Diana says meet the needs of the patient. And absolutely, yes. So the content should be relevant to the reader. So you are going to choose what information the reader would really require, and does any irrelevant information confuse the reader? Now, if you look carefully, we have very subtly and quickly moved on to conciseness and clarity. So inclusion of irrelevant information is going to confuse the reader. It's going to impact the clarity. Your letter is not going to be clear, and that is what actually might come in the way of you writing a great letter. So now a lot of candidates indeed ask if the word count exceeds the limit, 200 words, the upper limit, is that going to be a big problem? Now, personally, I would say that OET is not counting the words 1, 2, 3, 4, like, okay, 200 words, perfect. No, that's not how it works. But at the same time, if your letter is pretty long, if it has indeed exceeded the word count, it might be a hint that you have included irrelevant information. So, because of the inclusion of irrelevant information, it might impact the marks you score in conciseness and clarity. And that is a problem. So, the real problem is not having a few additional words, a bit longer letter. The real problem is that a longer letter indicates that you have indeed included irrelevant information. So keep that in mind. And is the language and style suitable for the reader? If you can carefully look, I'm touching base with two criteria: the criterion of language and genre and style. So let's look at a few important aspects. Nerman is asking about something. Sorry, if there are many measures of BP fluctuating between high and high normal values, should I write them all in the letter, or how to summarize them? Nermin, it depends on to whom you're writing, and are those fluctuating values important for that reader in treating the patient? For instance, if you're writing to, let's say, the emergency department, the emergency physician, and it's an urgent letter, those values, the fluctuation might be important. For instance, it could be, pretty a determining factor in what the patient is, going through and what treatment might be required. But if it's, let's say, a discharge, it might not be important at all. In fact, you might not even mention it, except that the patient has a hypertension, depending on to whom we are writing again. So I've got a lot of examples lined up, which should explain that to you. Usha says writing with good vocabulary and sentence is very difficult. Yeah, you can work on it indeed. So please be in touch with our counselors if you need any training. We'd be happy to provide you with that. Now, the aspects which I want you to look at this stage is tone and register and the use of abbreviations. What do you mean by register and tone? Tone and register. So depending on the reader and your role and the patient, there will be slight changes in the tone and register. So it's about how formal or informal you sound, the choice of words, and abbreviations. Yes, coronary. Sorry, it's not your name, I suppose. I'm not sure. But can we use abbreviations? Yes, you can use abbreviations. Now, that depends on to whom you are writing. For instance, if you are writing to a cardiologist, you can use MI, STEMI, all those things which a cardiologist, it belongs to his domain. If you're writing to, let's say, an orthopedician, you can write OA and, anything related to orthopedics. So, yes, in such instances, if the abbreviation is something that the reader is quite familiar with, it belongs to his specialty, yes, you can use those abbreviations. However, remember that too much of abbreviations, too many abbreviations in the letter might not look good. But again, the reader awareness is what's crucial. If you're writing to somebody who might not be a specialist, like you're scaling down a specialist to the GP, it would be better if you expanded it rather than use the abbreviation. All right. So to help you improve the skill of writing to the reader, or how the reader impacts your choice of content and language and a lot of aspects. I'll be dissecting a case note for you, and then later you can access the entire case note, set of case notes with a free sample letter. So let's imagine a patient, Hazel Logan, and I'll be showing you the case notes right now, and then we'll come back to it and look at a few parts of the case notes and see how, when you write to three different readers, the information and what you write and how you write will be different. So here is the basic information of Hazel. Her date of birth, 30/12/1961. She's 60 years old. She lives in Melrose Park, 17 Winterberg. Rup is asking if you have to write difficult vocabulary. Not really. Now, the family background: husband Benjamin Logan, daughter Kylie, lives with family in Sydney, so not with Hazel. Son Fred lives in the UK, single, both rarely visit. And here is a social history: lives in own home, both retired, occasional drinker, used to enjoy parties with friends, stopped going out, seeing friends for a few months, it seems, recently withdrawn. Husband attributes it to possible mobility issues, unable to do household chores. She has rheumatoid arthritis, mobility restrictions. The husband does cooking and cleaning, finds it difficult to cope. Please don't forget to like and share this live stream so that uh, any of your friends or colleagues who might be interested in preparing might be benefited as well. And here we come to the past medical history. So she has a 20-year history of rheumatoid arthritis, hypertension, high cholesterol, insomnia. She's been lethargic, losing weight, occasional numbness and tingling in extremities. Her medication: it's been meloxicam, Acidrex, and niacin. Uh, Narmeen is asking if the doses and administration route are important. Well, it depends. If the reader requires all those details, so SL or main, all those things. Um, well, I'd say if like the reader is directly involved in the administration of the medication, like a community nurse would make sure, then the administration and the dosage would be important. Yes. So you'll have to make that decision how important it is, actually. Yeah. Coronary is asking if the date of birth is mandatory to be mentioned. If you have got the date of birth, it would be better to write the date of birth and not the age. If the date of birth is not given, then the age would be fine. So here is her admission. So she had an urgent admission with severe abdominal pain and vomiting and blood-stained diarrhea, diffuse tenderness, had deep abdominal palpitation. A CAT scan was performed, and stratified mural thickening was found in the entire right colon. The temperature was 37. So here's the diagnosis. She was diagnosed with colitis, possible NSAID abuse. So a blood test was ordered, and she was started on an antibiotic therapy, tazobactam. Right. And then 2 days later, she responded positively. Husband noticed tablets for pain finishing faster than usual. Possible overdose. Patient denies, eventually admits. Reluctant to discuss health issues. So an LFT was done. Elevated levels of SGPT, SGOT, and that helped in establishing the NSAID abuse. A psychological assessment was done. She was transferred to a psychiatric ward. Danya Sandosh is asking, how many sentences can we include in one paragraph? There is no fixed rule on how many sentences you could write in a paragraph, but the paragraph should have either a central theme with a main idea, or it should be based around a particular date. If someone told you that each paragraph should have whatever number of sentences, it's absolutely wrong. And if someone told you that an OET letter has, these many paragraphs, that's also wrong. However, generally, 3, 4, or 5 sentences would be perfect. Although there's no absolute rule that dictates how many sentences in a paragraph or how many paragraphs in a letter. That's not precise, because you cannot actually restrict a paragraph. If you have got this is something that's circulating around, because a lot of candidates did indeed ask me if, a paragraph has 3 sentences and can I write a 4th sentence in that paragraph. Absolutely. It's not the number of sentences that makes a paragraph a paragraph. It's what is the topic, what is the theme of that paragraph. Usha Mahat is asking, can we write the same sentence or word we used in introduction, same one in starting of body paragraphs, like underwent total hip replacement surgery? All right. Now, you'll have to balance. It's not a good idea to repeat the same word a lot of times. You can indeed use paraphrases, but be sure that it doesn't impact the accuracy. Again, if you try to paraphrase, but clinically it is not accurate, that is not a good thing, and it might affect your marks in the criterion of content, where selecting the right information and presenting it accurately are the things which are judged. So if you have a hip replacement surgery, definitely you can write it again, but it's absolutely fine to write the surgery. You don't have to really repeat it, but there's nothing wrong if you use it one more time. That's fine. There's no rule, but you can connect reference so that it shows your ability to use reference markers. Okay, so finally we come to the discharge plan. So a couple of referrals to a drug outpatient rehabilitation clinic for CBT and counseling and alternative therapies once a week from 16 to, so that's next week. refer to occupational therapist for home visits and for suggesting modifications, for improved mobility and safety, and referral to the community health nurse for home visits, follow with the GP for management of hypertension, dyslipidemia, and insomnia. Now we are going to look at 3 readers. So firstly, you have to write to Ms. Sophie Dawson, who is a rehabilitation services manager, the manager at the drug rehab center. Remember? So this is the first person you will write to. And the second person you're going to write to is to the community health nurse, Miss Dorothy Sackwell. All right. And the third person you're going to write is Mr. Stone, a community occupational therapist. All right. So we are going to look at how this set of case notes will be different when you write to 3 professionals, keeping these 3 readers in mind, and how hugely different their needs are going to be, and what differences will there be in the kind of treatment, further care and management of her condition that these professionals will be providing. So Diana Phillip is asking about the order of paragraph is sometimes confusing. Diana, the order depends on the reader and the patient and a lot of things, but primarily what the reader wants to know first. So if you're writing an urgent letter, for instance, the urgent matter should come up. But if you're writing a letter on a timeline, a chronological letter, and usually this would be something which is routine to the reader, and has multiple visits. For instance, somebody had joint pain a couple of years ago, and then it progressed into arthritis, and moving on to surgical management and things like that. That would be better in a timeline. So a chronological letter. So you start with after the introduction, you'll start with the initial visit, and then so on. But if there are multiple aspects to the patient's condition, you will focus on what is the reason of you are writing now, and that will become the central theme. So that will come up, and the other relevant history and comorbidities will come later. Yes, so I hope that answers your question, Diana. Nifita, hello. Thank you. So we're going to now, before that, if you want to download this entire set of case notes with the sample response, it's now available at our website called irslearning.com, and you can freely download it if you use the coupon code all stars. All right, so make sure you make use of it. It's absolutely free for your reference, and we'll be adding more content, free content for your reference. All right, so I'm going to take snippets from the case notes. So we'll look at the social history and analyze how this will be written to the 3 professionals. Can you look at the social history, keeping the rehabilitation services manager in mind? What would you choose as relevant content from what you have on the screen. The notes on social history. Shamli is asking, she has been initiated physiotherapy, or she was initiated physiotherapy. They look a little bit confusing, honestly. Try to keep your sentences simple. All right, so I'll come back to you, Shamli. But thanks for that question. Try not to complicate, with unnecessary grammatical formations. Dorothy says rheumatoid arthritis. All right. Okay. In your chat box, can you type in what might be relevant to the rehabilitation services manager? Rashmi says mobility issues. Recent withdrawn, I suppose. Mobility issues, Usha. Shima says rheumatoid arthritis. Susma says mobility issues. Pure says lives in own home. Robbie says mobility issues. Deepa says mobility restrictions. Rube says mobility restrictions and rheumatoid arthritis. Manju says everything is relevant. Maria says she used to drink but has recently withdrawn. Donabella says mobility issues, unable to do household chores, rheumatoid arthritis, mobility restrictions. Good to see a lot of different responses coming through. Ash says limitations, I think. Asmita, mobility restrictions. Rube says recently withdrawn. Great. So this is what I thought would be relevant to the rehabilitation services manager. All right, now Arya says occasional drinker, mobility restrictions, unable to do household chores. Yeah, so now somebody was asking about lives in own home. If you look carefully, this was an outpatient service. So being an outpatient service, whether this patient lives in her own home or in a rented apartment or in an independent unit or a retirement village, doesn't really matter to the rehab manager. His or her focus is going to be entirely different. Yeah. If you have been used to writing constantly, including information like lives in own home and all, I want you to rethink if it's going to be really relevant for the reader. So I've got a task for you. Just condense the relevant information, and now I want you to put it in a sentence or two sentences, maybe, possibly. Usha, unable to cope with household chores, is actually the husband. And so we are writing now to the rehabilitation services manager. for the rehab therapy for Hazel. So can you make it into a sentence and put it in your chat box? So here's an example for you. It's not the beginning of a paragraph, so that's why you have those dots at the beginning. So he had also recently observed that she was withdrawn, but had linked this to her reduced mobility difficulties due to arthritic pain. All right, she is socially withdrawn. Okay. Now, to save time, we are quickly jumping into what might be relevant for the community health nurse. Jyoti says she is suffering from rheumatoid arthritis for which she has difficulty in walking. Chantal says patient has mobility restrictions due to RA. She used to be outgoing, but recently she stopped and he observed that she is withdrawn. Shima says Mrs. X has history of arthritis, which leads to mobility issues. Nobuko, she says socially, Hazel Logan used to party with friends, but has recently stopped. All right. Yeah. Maria says she has mobility issues as she has rheumatoid arthritis. Right. And finally, can you look at what might be relevant for the occupational therapist? Sorry. Now, for the occupational therapist, lives in own home is important indeed. So here comes your next task. Can you transform this into a sentence? The relevant content from the social history for an occupational therapist. So you have 4 bits of information for the occupational therapist. I want you to understand why all these things might be important for the occupational therapist. You can now type in your answer for this question, which is, how do you transform these notes into a sentence or sentences which are going to be helpful and targeted for the occupational therapist, giving relevant information for the OT to do what he or she has to do. In this case, he. All right. Maria says Mrs. Hazel lives in her own home, but is unable to do household chores since her diagnosis of RA has affected her mobility. At the moment, her husband is cooking and cleaning. However, he finds it difficult to cope. All right. Yeah. Dorothy is asking what is the duty of an occupational therapist. Now, generally, what an occupational therapist would do is, do an ergonomic assessment, do an evaluation of home or workplace, keeping in mind mobility and safety. So they will suggest or recommend a modification, like making the place free of slipping and other accidents, safety evaluation, installing, let's say, handrails, toilet raiser, all those things, or so all those things are primarily what an occupational therapist does, though they do a lot more than that. Absolutely. So in this case, since Hazel Logan has got mobility issues, and the RA, the rheumatoid arthritis, is coming in the way of her doing her household chores, the occupational therapist will come and make sure that things are safer, um, things to help with her mobility. Maybe if there are stairs, for instance, a stair lift can be installed, all those things. Absolutely. Right. Shima says she lives in her own home. She has difficulty to perform household chores due to mobility restrictions. Therefore, her husband helps her for household things. Jyoti says Miss Hazel has, I suppose, been suffering from rheumatoid arthritis. She lives with her husband. However, due to her arthritis, her mobility is reduced and she is unable to do household chores. Her husband helps her. All right. A bit lengthy though. Try to make it brief, but a very good attempt. Divya says she lives independently and has mobility issues due to rheumatoid arthritis. All right. Um, well, Dorothy, the rehab is for the drug abuse, for the psychological aspects, whereas this is, home modification and things of that sort. So it's not the same. Praise is her mobility restrictions, therefore is unable to do her household chores. All right. Tess, she lives alone and is unable to cope with household work due to rheumatoid arthritis, as evidenced by decrease in her mobility. All right. Um, if you could replace that evidenced, it sounds a little bit off, but that's a good sentence. Otherwise, Queenie says she lives in her own home but is unable to do the household chores due to mobility restrictions. Therefore, her husband does the daily routine. Uh, Alia says she lives in her own home and has difficulties in performing activities of daily living due to arthritic pain. All right, Alona, Miss Hazel lives in her own home. However, she's unable to do household chores due to RA. However, her husband cooks and cleans for her, but difficult to cope. All right. Oswald, she has RA leading to mobility restrictions and has difficulty doing household chores, for which the husband does the cooking and cleaning. All right. So good to see that you are getting the hang of transforming these notes into sentences. So here's another example for you. Ms. Logan lives at her own home and finds it difficult to manage household chores as the rheumatoid arthritis restricts her mobility. Her husband does the cooking and cleaning, although he finds it difficult to cope with. All right, now let's move on to the next part, which is the admission. What do you think would be relevant for these three professionals? The rehab services manager, the community health nurse, and the occupational therapist. Perhaps I, I don't want you to type all of it in now, but if you do have a notebook or something, it would be great to take notes and make a table with these three professionals and you know, make quick notes on what might be relevant. Okay, so this is what I would write if I were to write to the rehabilitation services manager. Now, even the admission might not be really, really relevant, but as you weave the story, the narrative, it's all right to include it as part of. Yeah, brilliant, Dr. Violetta. You've done it well. Admitted to emergency department for abdominal pain. I don't know. They say is presented to hospital with severe abdominal pain. Yeah, right. Yeah. Again, for the community nurse, it's almost the same. Just you have a passing mention. Mm, yeah. Now, when writing to someone like a community nurse, you might ask if the other presenting signs or findings are not important. You have to basically analyze the reader, of course, and what the reader is supposed to do. So, in this case, Hazel is being discharged, and the community nurse is being requested to make home visits. So now, if you look at the case notes, you have a diagnosis coming up. Dorothy, yes, that's what I'm explaining, why the others are not relevant to the community nurse. So, having made a definitive diagnosis, the signs and symptoms at the time of admission, or the presenting signs and symptoms, are not relevant. Perhaps you can summarize it, but otherwise, including all of that might not be important. Remember, the patient had this admission, had all the presenting complaints, tests were done, definitive diagnosis of colitis was made, treatment was done. For instance, the tazobactam was done, it's completed, now the patient is being discharged. And so, of course, in the rest of the letter, you will indeed mention about the diagnosis, but what led to the diagnosis will not be really relevant. If required, you can just summarize, and that's part of the summarizing, that we have chosen that it was an emergency admission with severe abdominal pain and other symptoms. That's fine. So this is one area where a lot of candidates do make a lot of mistakes. That's my personal experience as a trainer, and so I always tell students, candidates, that you should be careful not to include all the clinical information which might not be important now at the time of discharge. So for post-discharge home visits, what happened before the diagnosis was made is going to be not at all important. If you do include all those things, in fact, you will be questioning the person, the doctor, perhaps, who made the diagnosis. Really, did you diagnose properly? So that's not really important at all. So make a note of it, because sometimes you get wrong information from other sources, and you end up including a lot of unnecessary information. Now let's move on to the occupational therapist. Perhaps the occupational therapist doesn't need any of this at all. That's going to be interesting, because even the narrative about the emergency admission can be omitted. Anjali is asking about restricted connectives. That could be for another day, but if you go to OET's official blog, OET has published an article on it. So check out that link, which is in fact a very useful one. So let's now move on to another part of the case notes. What might be important to the three professionals from this? So this is what would be relevant for the rehab services manager. A lot of the information on the second day of admission. Group is asking about the CAT scan. You can mention, but it doesn't really make a huge difference, because based on that, based on the stratified thickening, the diagnosis has been made. So it's not really really important. And here is what is important for the community health nurse. And finally, there isn't anything really important for the OT from this day in hospital. Now I'll show you one more snippet from the set of case notes, the discharge plan. What should you write to these three professionals? So I'll give you a few seconds to plan that as well before we wrap the session and I take a few questions. All right. So here's what might be important for the um, rehab services manager. Now, I want you to remember why the referral to the rehab clinic is not important, because that's what you're doing. So if you are writing to the manager, then you don't have to write that the manager has been informed, because that's what you are actually doing. But apart from that, everything is important. Now, keeping in mind that it might be a multidisciplinary care for her, the other visits, like the community nurse and the GP following up, could be summarized. Doesn't hurt to do that. Although you don't have to, include all the details of what they might do. Sorry. And similarly, here is what might be, important for the community health nurse. Now, the community health nurse is someone who might be liaising the care, coordinating the care of Hazel Logan, because that's what most community nursing or district nursing services might be requested to do. So, in that aspect, you can summarize about the other care provided, especially the rehab therapy in the rehab clinic, and the OT visiting, and what the GP might do. But the visit of the OT and all could be summarized. You don't have to include all the details. And to the OT. Right. So the OT doesn't need a lot of information from this. Mostly what he has to do, and then the community nurse visits and the GP following up could be mentioned. All right. So I hope that you have learned how important the reader is in getting it right in the OET's writing, and I do hope that you'd write better. A few of you did ask for the coupon code and how to download this entire set of case notes and the sample letter. So it's again on the screen for you. And if you have got any questions on writing, especially based on what we have done, I'll take a few questions from you. So thank you very much, everyone, for being part of this, having me to teach you. And IRS Group, as an all-stars premium preparation provider, is happy to give top-notch expert training for all OET aspirants. And our online learning wing, IRS Learning, has got a lot of training programs, one-on-one courses, which my colleagues and I run. And so you can have a one-on-one with any of our expert trainers, and a lot of corrections and one-on-one speakings as well. So thank you very much, everyone. And if you have got any questions, please put it in the chat box. I'd be happy to take on your questions. And I wish you great success in your OET test. And hats off to all health professionals who still continue to work hard throughout this pandemic. And Sania is asking, do we need to mention dates of visits and follow-ups? All right. It depends, Sania, if those are relevant. Indeed, and for instance, you can, to give clarity and to be precise, dates might be important. Yes, use of OET is important for nurses who want to go to English-speaking countries. And thank you, everyone. I appreciate your gratitude and your words of appreciation. And IRS Group is happy to be able to give you good training and sessions like this, which is for all OET candidates, helping you to be in that high band area. So thank you very much, everyone. I'll see you soon with more on OET preparation. Thank you.